Hi, I'm Dr. John Hovannessian. In this video, we'll talk about what to do after you've had eye surgery, including what limitations in your activity you should observe, and what rare early warning signs of trouble you should report to us right away. Because there's a lot of information here, you may want to watch this video more than once. To protect your eye after you've had surgery, you'll have either a patch or a clear cover on your eye, depending on the procedure. In some cases, we'll ask you to leave this patch on until the next morning, and in others, we'll ask you to take it off the same day. Check your instruction pages, which will tell you when to take off your patch. Once your patch comes off, throw away any cloth bandage part that's attached inside, but keep the rigid shield. You'll need the shield for the next week or so because you should tape it onto your eye before going to bed at night for the next 7 days. That way you won't accidentally rub your eye and do harm while you're sleeping. You can use normal medical tape to secure the shield on the eye. After most surgeries, you'll need to take eye drops and sometimes medicines by mouth to help your eye heal. We'll give you an instruction page and prescriptions telling you exactly what to take and when. Take time to learn the names of these drops and how you're supposed to be taking them. These drops usually continue for 3 or 4 weeks and sometimes longer depending on the procedure. If you normally take eye drops for glaucoma, we would like you to continue to take them after surgery just as before, unless we tell you otherwise. If you take artificial tears or lubricating eye drops, these are also okay after surgery, but it's best to use a fresh and newly opened bottle for sterility reasons. For any combination of drops, try to wait 5 minutes between taking any 2 different drops. That allows the first drop to absorb into the eye instead of being washed away by the second. You may want to watch our separate video showing how to safely take eye drops. For the first 1 or 2 days after surgery, you may feel groggy. You may feel a little nauseated or dizzy or have other symptoms of feeling unwell. These are common side effects that linger after the surgery because of medicines that we use. These are the medicines that relax you during surgery. And because of these symptoms, we recommend that you not drive until at least the next morning after surgery, and possibly longer depending on how you feel. Fortunately, serious pain is really quite uncommon after eye surgery, but many people have a little discomfort or a scratchy feeling like having an eyelash in your eye during the first 24 hours. Usually Tylenol or Advil or aspirin are enough to take care of any discomfort you have. And you can feel free to take really any pain reliever that normally works for you. Just in case you have more pain than that, we'll prescribe something stronger that you can take as needed. Don't hesitate to take pain medicine when you need it. It will only help you heal. But if your pain is severe, you should call us at the phone number on your instruction pages right away. It's common for your vision to be very blurry for the first few days after surgery. It's also perfectly normal to see floaters or black spots in your eye as well. There can also be a reddish image in part of your vision and an overall change in the way you see colors. These are normal symptoms. But if you notice your vision getting progressively more blurry or more dark over time, please call us right away. We recommend that you rest for the rest of the day, but it's okay to watch TV, to read, or to work on a computer. It's also okay to resume your normal diet as your appetite allows. The next day you can resume most normal activities, but there are a few rules. It's okay to shower the next day, but it's best to turn your back against the shower spray. The next day it's also okay to walk for exercise, to use a computer, to read, to go to work, to cook, and to do light housework as long as you're not lifting anything heavy or straining yourself. You can drive a car the morning after surgery if you feel well enough to do so safely. With the exception of some retina surgeries where gas is put inside the eye, it's generally okay to fly in a plane and do most activities that feel comfortable after surgery. If you're in doubt, just err on the side of caution, and of course you can always ask our staff. Activities we ask you to avoid for the first week include any heavy lifting, like more than 30 pounds, or vigorous sports like tennis or golf or running or biking. You should also avoid wearing eye makeup for about 1 week after surgery. We also ask you to avoid swimming in a pool or the ocean or going in a hot tub for about 2 weeks. It's not necessary or required to wear sunglasses after surgery any more than you normally do, but you may feel more comfortable with sunglasses when you go outside. What's most important is that you don't rub your eye and try to keep it protected from injury while it's healing. With most surgeries, the eye will look fairly normal, but there may be some bright redness on the eyeball. It usually takes 2 or 3 or 4 weeks even for this to gradually fade away. This is especially common for people who take blood thinners or who bruise very easily. Bruising of the eyelids or around the face, which looks like a black eye, is also fairly common after eye surgery. That's because even the smallest amount of bleeding from the tiny vessels around the eye can really be quite noticeable. Please be patient, and this bruising will fade away over just a few weeks. I hope this information is helpful, and I encourage you to ask our staff if you have any specific questions about your surgery. I'm Dr. John Hovannessian. Thanks for watching.